Welcome to my world, the world of the medical laboratory scientist. Health is wealth, knowledge is power. Today's topic is causes of kidney failures and dialysis. We know there are so many organs in the body, more than 78 organs, and the vital organs are even up to 12 or more. But with every organ, it's like a gift that majority of us or some of us don't really cherish and take care of. When you buy a car, you want to take care of. When you buy something, you want to take care of it. But these organs are there that we are supposed to take care of, and that is why I have this interest of making this topic very interesting. The kidney is a very vital organ. It functions mainly to filter, to remove waste that will damage our body if not removed. And to do this function, we don't have to put too many waste. You can imagine when you think that something is a place for dislodging waste, then you now put too much, you overwhelm that area. And that is one of the things that we do usually. So let us look at what would cause the kidney to be damaged to the extent that it fails in performing its functions, because the function of the kidney are many. One of them is the filtering of that blood so that our blood continues to give us the vital nutrients and oxygen, and it is maintained in a situation condition that does not in any way affect any other system or organs of the body. So dialysis is another issue, because when you have been able to damage your organ, whether unknowingly or probably through familiar reasons, genetic, then how do you maintain your dialysis as well? How do you go having an idea of what dialysis is all about? Because it's more or less a replacement of the kidney, but the true replacement is transplanting a new kidney. So join me in the slide section when I expose all the causes and also talk on dialysis and the vital role the laboratory plays in all this. The outline: objective, introduction, causes, lab diagnosis, dialysis, intro, and conclusions are all that I shall be talking about. The objective: to create more awareness on the cause of kidney failure, the laboratory parameters derangement to look out for that will warrant the alternative of dialysis to stay alive. The introduction: the WHO reports that kidney failure prevalence estimates range from 9% to 13.4%. CKD, that is chronic kidney disease, is a leading cause of death and disability, projected to become the fifth leading cause globally by 2040, rising up from the 10th in 2020. The incidence and prevalence of CKD are increasing, particularly in low and middle income countries, driven by factors like diabetes, hypertension, and obesity. People of all ages develop kidney failure, but the risk increases with age. According to the CDC, about one-third of U.S. adults over age 65 have CKD, almost triple the rate of people ages 45 to 64 with CKD. About 815,000 Americans are living with kidney failure. Nearly 55,000 Americans are on dialysis. Kidney disease is growing in an alarming rate all over. Let us peep into the internal organs. The urinary tract system is what you are seeing right now. The kidney being the main actor, and then it goes out to the urethra, to the bladder, and then through the urethra to the outside. But the kidney, before it can pass out the urine, it must remove the good substance. And how it does it is that it filters. It allows only water and some waste to pass through. The molecules, bigger molecules like red blood cells, those that are beneficial to the body, it will not be allowed to pass. It is only when it is damaged that the red blood cells and bigger molecules start passing, that you start seeing your urine as turbid or bloody. That is the sign of chronic kidney disease, especially when it continues for over 3 months. So this picture shows clearly that we have two kidneys and they have the. Yeah, this is the cross section of the kidney. You can see the red mark showing that red blood, unfiltered blood, comes in. When it is filtered and becomes less full of waste, is the filter showing the going out, the blue color, and the urethra passes it to the bladder, and it comes as urine. Yes, what we are now seeing is the nephron. It has so many nephrons, and basically it's just the funnel, and you can see the entry point of the red blood cells. I mean the renal artery. So it enters through that wide mouth, and the blood is filtered and it goes through the tubule, and the blood itself now go around the tubule where it is necessary. The sodium, the salt, return back into the blood to attract more water, so that it could even cause higher blood pressure, or it could be a situation of more water now being retained in the tubule, so that the salt being retained, so that more water are now passed out as urine. But this is basically the filtering aspect. There are so many explanations of the functions of the kidney that I cannot able cover with this little time. However, the glomerulus, once it is damaged, allows bigger molecules, blood and other things to pass out, and that color the urine. Yeah, now to causes. According to Tan, the leading causes of kidney failure include glomerular disease. Just like I mentioned, that big bow, the Bowman capsule. Once that area becomes damaged, it's or infected, or there is a stone in it that widens the pores. The pores becomes the beginning of kidney failure. Once the pores are widened, the urinary stone also could block or even widen the damage the pores. An infection, like I said, would create that bigger hole. But an unhealthy lifestyle is a major contributing factor. When we talk of unhealthy lifestyle, we were talking of where you deprive yourself of physical activities. Sleep deprivation is also unhealthy. Poor hygiene, where you do not take care of your hygiene. Inadequate water intake. Dehydration will cause stones or crystals that may even come that cast, result in casts coming out of your urine. Frequent urine retention, excess alcohol and tobacco use, high salt consumption, excessive intake of meat, sugar, fried food. These are all even indicated in cancer cause, and processed food and unregulated drug use. Drug use can also damage so many things. However, diabetes is the most common cause of kidney disease, both type 1 and type 2 disease, but also heart disease and obesity can contribute. Now to lab diagnosis. Yes, you have two different diagrams here, how to explain the kidney disease. The upper one shows a kind of compass that when the kidney is normal, you find the estimated glomerular filtration rate showing 90 to 120 readings. But as soon as it starts getting early stage of kidney disease, you find it coming down to from 90 to 60. And when the kidney disease is getting worse and worse, it goes down as low as 15 when you have kidney failure. All these stages are described as stage 1, stage 2, stage 3, stage 4. Stage 5 is where the kidney failure that could warrant dialysis or kidney transplant. But How do you move from this stage to stage? You can use the your values, the laboratory diagnosis. That is, what are the kidney function tests you do? These are listed here in the diagram that is exposed again. So you can see the values you are aiming for. Those values that will help you to know that yes, the kidney is still filtering. It has not failed in its function of controlling the quantity of these things that passes through. But when the kidney has failed, all these values will grow up. And then what can make it grow up are those things that really cause it, which includes too much protein intake and stuff like that. Dialysis intro. Yes, this is a picture of the dialysis machine you can see. And you will see the person those days, is a bigger machine, not portable. You have the one almost semi-portable, and then you have the one that is possible that you can even use at home for yourself. Dialysis machine works by blood being removed from the patient, passed through the dialyzer, which contains the dialysate, and then it is now gradually passed through and back to the patient. It will remove water, remove the waste, so that the new blood that comes in is cleaner and more useful to the body than the one containing the waste that could poison the body. Yeah, conclusion finally. Kidney failure or end-stage renal disease is highly devastating for people living in developing countries because most of their health insurance policies do not cover the expenses involved in treatment, especially dialysis, whereas the contrast is the case in developed countries. There is an increased incidence of CKD because people survive longer on dialysis treatment, unlike when it was first introduced in 1924 and became common practice from 1960. However, the medical laboratory is very useful to monitor the derangement of kidney function so that one can get it at the early period. The early onset of kidney failure or kidney disease rather is very important, so that by that time, once you know your kidney is gradually being damaged, you are conscious and doing something conscious to return the kidney back to the good state. Usually that is possible. It is only when it is seriously damaged, that is the end-stage renal failure, that one renal disease, that one can do virtually nothing than dialysis or go for transplantation of a kidney that is highly functional. But you must need the immunosuppressants to use with kidney transplanting before you want to survive. As usual, if you like my presentation, watch more. There are so many videos on this channel. So ride on. Thanks.